Hi, my name is Dr. Mark Halpern. I'm a chiropractor, and today we're going to be talking about the causes and treatment of carpal tunnel syndrome. When you have carpal tunnel syndrome, there are always two parts. Some of it is caused by the neck, and some of it is caused by the wrist. If we look at a human spine, the nerves in the lower part of the neck are the ones that go down your arm and to the wrist. If there's any compression at the lower neck, it will always affect the way the wrist functions, heals, and also feels symptoms. To properly address carpal tunnel syndrome, you also have to have your neck assessed. When looking at the wrist, you should go to a practitioner who understands all of the little carpal bones of the wrist. There are 8 little bones. They look like cobblestones, maybe about this big. They form an arch called the carpal arch. So underneath here, going through here, is the carpal tunnel. And when the arch begins to collapse, it compresses everything that's going through the tunnel, leading to the numbness, tingling, pain, and weakness in the hand. Unless the wrist is recreated and the bones are recreated to form that arch, you cannot get rid of this weakness. Because in fact, it's not weakness, it's the muscles are not in their proper alignment and not able to pull properly. Most of the common wrist splints that you wear or go to your local pharmacy, if you look, most of them put the wrist into slightly extended positions. I don't recommend using any of those. When the wrist is neutral, it's able to heal and the arch can be maintained. But when the wrist is extended, that's when the arch begins to collapse, most commonly by people who type and have the wrist arched. So make sure that if you're going to get your wrists and neck looked at, that the practitioner is aware of both the way the carpal bones work and the function of the nerves in the neck. And so for all of you that suffer with carpal tunnel syndrome, there is light at the end of the carpal tunnel. And remember, strive to thrive.